Good afternoon. Today I will be speaking about the opioid epidemic in America. Between the years of 1861 through 1865, battlefield medics during the Civil War used morphine as a pain reliever for wounded soldiers. By 1898, the Bayer Company began to produce heroin for chronic pain. Congress passed the Harrison's Narcotics Act in 1914, stating that doctors must write prescriptions for narcotics. Short-acting painkillers were introduced in 1970s, but these painkillers only lasted up to 6 hours. In 1980, a Boston physician recorded the effects of drugs prescribed to patients in the hospital. He studied that opioids given to some patients caused them to become addicted, but the study was never considered accurate since the patients were closely monitored by nursing staff. Medical professionals in 1995 considered the addictiveness of oxycodone, but still approved OxyContin for prescription use. They also approved the medication Actic for chronic pain management in 1998, even considering that the main ingredient, fentanyl, had higher rates of overdose even with strict prescription guidelines. The Department of Mental Health and Substance Abuse Services of Tennessee reported in the 2000s that prescription opioids were being overprescribed and were the top substance used in treatment facilities and halfway homes. In 2003, pharmaceutical companies began to change their advertising strategies for opioids. The FDA warned the company Purdue Pharma about the misleading advertisements for OxyContin, but not disclosing the potentially fatal risk of the drug. Several state governments sued Purdue Pharma for advertising the drug as a non-addictive alternative to other pain relievers. Purdue Pharma pled guilty to the charges and paid $634.5 million in fines. The FDA released an abuse detergent form of OxyContin, stating that this drug could not be crushed, lowering the possibility that it could be snorted or injected. After the release of the new OxyContin, the use of heroin went up by 42% in America. In 2015, the operation known as Operation Polluted arrested 280 people in the states of Arkansas, Alabama, and Mississippi for the trafficking and abuse of pharmaceutical drugs. The CDC published strict guidelines for prescribing opioids for chronic pain in 2016. In March of 2017, President Donald Trump signed an executive order establishing the President's Commission on Combating Drug Addiction in the Opioid Crisis. In July, the White House panel released a report declaring the opioid epidemic a national health crisis in America. The financial cost for the healthcare services for opioid addictions and overdoses has had an enormous effect on federal, state, and local governments. The cost of funeral expenses for families, healthcare provisions, law enforcement provisions, food assistance, housing, social services, and the treatment for infants born addicted to opioids cost the American government nearly $78.5 billion annually. In 2011, 16,917 people had died from opioid overdose. That rate rose to 18,893 people in 2014. In 2015, there were 22,598 deaths. By the year of 2017, that rate had risen to an astonishing amount of 17,237 overdose deaths. There are two categorizations for the signs of opioid overdose: physical and psychological. The physical signs are decreased or increased appetite, large or small pupils, impaired coordination, slurred speech, consistent runny nose, changes in sleep, breath, body, or clothing odors, and decrease in hygiene. The psychological signs are anxiety, increased or decreased energy, irritability, mood swings, consistent nervousness, increased anger outbursts, paranoia, personality changes, unexplained fear, and the sense of the person being spaced out. If you suspect that someone is having an opioid overdose, lightly tap, shake, or shout the person's name to get a response. If the person is already unconscious, rub your knuckles hard on their breastbone in the middle of their chest. If the person does wake, keep them awake and dial 911. If you get little to no response, dial 911 immediately. If the person presents blue lips or has no breath sounds, perform CPR. Stay with the person until EMS arrives or continue CPR. You may save someone's life today.